In this video, we are going to discuss about the pros and cons of drinking tea or coffee during pregnancy. Coming to pros, coffee and tea are two of the most popular drink choices in the world. Now, more and more research is revealing that there may be a correlation between caffeine consumption during pregnancy and an increased risk of miscarriage or stillbirth. But what about breast milk intake? Breastfeeding is the recommended method of feeding for infants and is globally endorsed by numerous health organizations. Breast milk contains antibodies which protect babies from infections, and breastfeed babies have a lower risk of becoming obese. Coming to cons, the toxins in these drinks are associated with birth defects, premature birth, and miscarriage. Tea contains caffeine, which is known to be linked with fetal heart rate changes. Additionally, the potential for caffeine withdrawal can also be risky for the fetus. How much tea and coffee is safe to drink when you are pregnant? The research suggests that no known health benefits exist for pregnant women who drink either caffeinated or decaffeinated coffee. The American College of Obstetricians and Gynecologists currently recommends limiting caffeine intake to less than 200 milligrams per day, which is equivalent. Pregnant mothers are often told to limit their caffeine intake. Drinking more than 300 milligrams of caffeine each day during pregnancy is associated with an increased risk for miscarriage, low birth weight, and decreased length of gestation.
We should not have more than 300 milligrams of caffeine in one day for pregnant mothers. Tea and coffee contains caffeine, which can lead to negative effects such as sleep deprivation, headache, and decreased fetal growth. And even if you just drink a few cups of tea or coffee, the effects of caffeine might be more harmful than what you think. The World Health Organization recommends that pregnant women should limit their intake of tea and coffee to less than 300 milligrams per day. This is the same amount that is found in roughly 3 to 4 cups of tea or coffee. It is recommended to limit your consumption of caffeine in general during pregnancy. This includes caffeinated beverages, chocolate, and energy drinks.
The effects of caffeine on pregnancy and the facts you need to know. Caffeine is a well-known stimulant that can have many effects on the body. Some of these effects are good, others are not so good. For pregnant women, the effects of caffeine are not as clear-cut as they are for other people. We should not think that all caffeine consumption will lead to negative consequences for the fetus, but women who drink large amounts of caffeine should be aware about how it can affect their pregnancy. Tea is a popular drink that is consumed by many people, especially during pregnancy. Studies show that limited intake of tea, soda, and juice could reduce the risk of preterm birth. There are also reports that say that drinking 3 or more cups of tea each day increases the risk of miscarriage. Personally, I will not be drinking any tea during my pregnancy to reduce the chances of miscarriage. What about you? Babies are known to be more sensitive to caffeine intake than adults. Thus, pregnant mothers are recommended to limit their tea intake or drink decaffeinated tea.
Coming to conclusion, the answer to whether or not you should limit your tea and coffee intake while you're expecting the answer to this question is yes and no's, because it's important to be mindful of the caffeine ingestion that you're putting yourself through. No, because it's important to maintain a balanced diet for both you and your child. The recommended limit is 3 cups of coffee or tea per day. For more information and updates, visit our website babyneed.in. Thanks for watching this video completely. Please like, share, subscribe to our channel for more videos.